the biggest problem with the current system is that the decision making are driven more by profit than by how to get the most out of the dollars we have. In other words, we have a finite amount of money to spend on healthcare in this country because we have a finite amount of resources as a country as a whole. To make decisions based on what's going to put the most money in my pocket as opposed to make a decision about what's going to give us the most bang for the buck in terms of providing access to care, it's just a wrong-headed approach, I think, to decide, how you're going to deliver a limited resource. And we have to accept the fact that there is a limited resource. If COVID has taught us nothing else, that we have limited resources with which to provide care for people. And I authored that with Hugh and Pat Armstrong, who are a pair of sociologists who actually have been, over the years, have published many books, but were somewhat critical of the Canadian system. And so I learned a lot from them. But one of the things that I think is most important is that the public is involved in the decision making, and that they have healthcare boards, planning boards in every region, and it has to be made up of patients who are receiving care from that area, as well as people who are providing that care. So that it's important that the people who are delivering the care and the people who are receiving the care are in conversation together about what's the best way to address the problems of that particular community. So how you might spend your healthcare dollars in a community like say Southern Florida, where you have a lot of retirees or elderly people, might be very different from how you would spend those dollars in the Bronx. It goes back to a very basic premise, am I my brother's keeper, right? It's not just what I need, it's what my neighbors need.